stop discrimination by big insurance companies. This is why President Obama put forth consumer guarantees. 8 guarantees that he's saying, big insurance, we need to make sure you're following these. So I'm going to read them to you now. The first, no discrimination for pre-existing conditions. No exorbitant out-of-pocket expenses, deductibles, or co-pays. No dropping of coverage for the seriously ill. No gender discrimination. No annual or lifetime caps on coverage. Extended coverage for young adults up to 26 years of age. Guaranteed insurance renewal. And finally, no cost preventative care.
As a public health nurse and a parent, I've seen health care from both sides, from the care part and from the caring part. I know the cost of not fixing our health care insurance system. My story is not unique. I was pregnant and my twins were in elementary school when my husband was killed by a drunk driver. But right now, they're soon to graduate from college. And like a lot of young people, I wonder, and I know that what is the picture's going to be like for them for health care. And as a working mother, I've done all I can to help them, but they're going to have an insurance crisis issue. I've been blessed enough to have a job where my employment takes care of my health insurance, and I've been able to help my family. But I've learned over the past 2 years, 11 million people have lost their employer and their health insurance. And that bothers me. I talk to mothers on the phone and parents who sacrifice not having their health insurance just so they can have health insurance for their kids. And it's important for them to have their children covered. Health insurance costs too much, and it doesn't cover enough. Health insurance reform means lower cost, higher quality, and more choices of plans that will fit what we need. And what does health insurance mean to me as a public health nurse? Public health goals include health promotion, disease prevention, and disease treatment. And I deal with contagious diseases like tuberculosis, E. coli, and the upcoming H1N1 virus. And we're gearing up for a flu season that's going to be unpredictable, and we're working hard to get ready because this disease will affect the vulnerable, like school children, the elderly, and those with chronic illnesses. Now, public health is our safety net against these contagious diseases, and it's true. You don't need insurance for the vaccines. But if everyone had health insurance, they could afford, it would make my job easier. And it would make us all safer. It would make sure that when my daughters graduate high school, they don't have to worry about whether or not if they get sick, if they're covered.